I'm Sarbaree Mishra and I'm a senior program manager. I have close to like 18 years of experience as a software engineer and program manager in various domains, including healthcare in India and US. As part of my role, basically, I oversee the implementation of AI projects at Molina Healthcare, and I'll try to share a part of this knowledge and experience through this talk. So moving to the next slide, to give a brief overview, as we approach the end of the first quarter of the 21st century, we know that AI is pervasive in our lives and it's completely revolutionizing the healthcare domain. So I would like to cover how AI is shifting paradigms in healthcare, go over the current landscape and the challenges facing us, and how the transformative applications are key to leveraging this technology. I'll also try to cover the industry best practices and application implementation strategies. And to conclude, I would cover the ethical aspects of AI in healthcare and what we can expect from AI in the near future. Okay, so let's start with the AI/ML revolution in healthcare. Now, we all know that currently the healthcare domain is, experiencing a fundamental transformation through the combined capabilities of AI, automation, artificial intelligence, and machine learning. Now, aided by these technologies, we have like unprecedented opportunities to improve the delivery of care, to also improve the operational efficiency as and even medical research. The If you think about it, the primary driver for these technological developments have been the exponential growth in computing power and the available medical data. Now this because of this growth in computing power, now this has enabled the computer scientists to design like more sophisticated machine learning algorithms which can go over like mountains of medical data is huge, so it allows the to for the algorithms to go over the mountains of medical data to train the AI models effectively. These models can then or are then used to extract information effectively and accurately, hereby saving countless hours of work for medical personnel. Now, combined with the increasing complexity of these medical challenges faced in the industry, the introduction of AI/ML will only improve and make the model of care delivery more efficient. I mean, humanity will be healthier. It is also important to note that AI/ML is not just a technological trend, but it's necessary to address critical healthcare challenges facing us today. Accurate diagnosis can save millions in unwanted tests and improve the patient satisfaction. Therefore, while one mode of treatment may be effective for a certain patient, we need to realize that it might not be fully effective for others, right? So, pursuing that mode of treatment can cost the patient more time for recovery and increase the coverage costs. AI/ML can open up the possibility of personalized healthcare. The machine learning algorithms can take into account the patient's medical history and suggest a mode of treatment which could be more tailored to that specific individual. It can even predict medications, therapies that might be required as the patient progresses through the treatment. Now, all this can greatly improve resource utilization, especially in global south where medical resources are more limited. Coming on to the next slide, I'll start with the current healthcare landscape and the challenges which we are facing today, and then discuss how AI/ML can actually help us tackle these changes. Now, it's a common knowledge that our healthcare system is completely fragmented. While the FDA guidelines stipulate common procedures and diagnosis codes, they don't, do enough to make the whole delivery of the care process uniform. So as a result, we still see that this industry operates on information silos, severely limiting the collaboration that should ideally have been possible today. And coupled with high diagnostic error rates, and as well as the increasing cost of healthcare to patients, are often denied the level of care that they expect. Now, unless patients are wealthy or influential, they mostly do not have access to personalized medical care, which can make a lot of difference in certain forms of treatment. Now, on the technology front, we have challenges stemming from the massive volumes of unstructured medical data. So, patient data exists everywhere in diverse formats, right? Such as EHR, which is the electronic health records, then imaging, then we have genomic data, and even we see, like, spreadsheets in doctors' offices. So, the patient data is everywhere. Now, handling this data involves complex privacy as well as regulatory constraints, leading to basically interoperability issues across the domain, because all these are PHI data. So we have to be very cautious. Now, AI/ML is tailored to help in this, fractured landscape through advanced pattern recognition and intelligence data integration. AI model can excel at summarizing information, and this can be leveraged to extract the most relevant information, make it usable, and probably archive the rest of the information. So we have seen, like, say, clinical notes summarization, because most of the time the nurses would have to who do that in the workflow. So they do this clinical note summarization. They have to go through a lot of data. They have to go over all the previous information of the patients, their previous services rendered, or what was their line of treatment. Now, AI can certainly help in this area and provide the summary. So AI models can also be trained to perform predictive analytics as well, and they can also, I mean, this can be used to design in near future some automated decision support systems, which can save valuable time during emergencies. Uh, Maybe when a doctor is unavailable for immediate assistance. Okay, I would go over some of the AIML applications that are completely transforming healthcare. Now, AI models are very effective in aiding and enhancing patient diagnosis. Now, in the field of medical imaging, we have seen that, we have these deep learning algorithms for early cancer detection, then radiology image analysis, and automated lesion identifications as well. Now, this can reduce the diagnosis times and improve accuracy when compared to human interpretation. These models are also very effective in the field of precision diagnostics, with fast genomic data analysis and identification of rare diseases. Because rare diseases, that might take the doctors much longer, as it involves combing through a lot of data. Now, learning from the patient's medical history, these models can also, recommend personalized treatment plans and classify various risk models as well based on the patient demographics. Now, on the predictive healthcare front, AI models are useful in patient risk modeling and performing operational analytics. They can also be trained to predict chronic disease, which can serve as, an early warning system for high risk patients. This can be useful also in preventing hospital readmissions through personalized intervention plans. AI models, because they'll be learning over time the degree of care delivered and the number of patients utilizing the care provided, the AI models can also learn this over the time. And this insight can be used to optimize the medical resource allocation, staff scheduling, and they can also assist, AI can also assist with the supply chain management by predicting the equipment maintenance schedules as well. Since we already know that most AI models perform exceedingly well on large data sets, this can be leveraged to personalize treatments for patients. While it is almost impossible for a doctor to keep like lengthy notes and refer them continuously for each patient, AI models can perform this task effortlessly, learning from an individual patient's medical history. The models can predict responses to particular drugs and tailor the treatment protocols accordingly, thereby minimizing the drug reactions. These models can also suggest patients to be included in medical study subgroups based on their medical history and responses to their drugs as well. Now, AIML applications can also supplement the clinical decision support system through real time treatment recommendation and evidence based guiding, which can be integrated with the existing clinical workflows, and it can serve as an extra pair of eyes to just bounce off ideas when investigating a complex medical any complex medical cases. So, moving on to the technical aspect of the talk, I would like to go over some system architectures, frameworks, and industry best practices for building AIML applications for healthcare. Now, the healthcare domain generates humongous amount of patient and medical data every day. We all know that. Therefore, any AIML software solution must be scalable to handle this volume of data. A cloud native design should future proof the application and definitely make it more accessible. It must adhere to the robust data governance frameworks based on the country of implementation, such as GDPR for European countries. Most importantly, these applications must be interoperable and provide the APIs for communicating with existing healthcare information systems. To achieve true success. Making the application cloud native requires a model and its associated code and data to be hosted on a with a cloud computing provider, right? So the three big cloud providers, they already have the platforms comply with these regulatory uh, requirements. So if the application is hosted with either AWS Healthcare or Azure Healthcare or a Google Cloud Healthcare, most of these compliances are automatically enforced. And it can also help, speed up the development and time to market. Since AIML is a very hot research area at the moment, computer scientists have open sourced many machine learning frameworks to the community. Some of them are like TensorFlow or PyTorch or Scikit-learn. These frameworks have been developed and vetted by the leading experts in the field and can be safely and reliably used for AIML applications. Apache Spark, Kubernetes, and Kafka form the recommended tools for big data processing, which have also been open sourced and thoroughly vetted by our experts. At this point, I would like to add some best practices that I have learned from my experience. Now, all AI model development should be incremental because this allows us to verify and validate the inner workings of the models and can greatly reduce any surprises afterwards. Once a model is built, it has to be continuously monitored for any changes to its expected behavior, and we have to see how it is behaving with all the data flowing in. Now we know that the medical data is protected by federal law. Therefore, all care must be taken to ensure that all the algorithms currently or which will be used in the model and in the application are transparent. Regular audits will ensure safety and security to these models, and an open algorithm allows experts to discover any vulnerabilities which can be exploited. So I firmly believe that all AI should be explainable because this will help people to understand the results of machine learning algorithms. When people are able to understand the algorithm, they are more likely to pass the regulatory requirements and minimize the risk. moving over to the next slide. So we know that we cannot build AI ML applications for healthcare without taking into consideration the ethical challenges and the data governance regulations. Since the patient medical records might be used for training models, we have to ensure that the PHI data is properly anonymized before training. Proper patient consent must also be taken and recorded before any patient data is used for model training. Training data must be carefully selected to ensure that it represents, the population that it would be later used for. Race, ethnicity, and country of origin should be carefully taken into account when training medical AI models. Finally, all algorithms must be transparent and AI models should be explainable. An organizational data governance framework must be established with robust ethical guidelines while handling patient data. This should include interdepartmental and interdisciplinary review boards as well, so that all of this data can be vetted for model training protocols. This is very important. All developed algorithms should be open to continuous auditing, and all application designs should follow a patient centric design philosophy to be most effective. Now, in order to conform to the government regulations, any AI/ML healthcare application must also comply with the HIPAA and the FDA guidelines and will only be approved for use once vetted by the respective government authorities. Now, this compliance should be adhered to at every aspect of application design. In order to engineer an application that is truly global, it should also comply with the international healthcare standards and be open to auditing from the regulatory authorities. Once we adhere to all these design philosophies, our application will conform to the responsible AI development principles. So, I would now like to talk a little bit about the future of AI in healthcare and how AI will shape healthcare in the near future. So, new strategies are being developed every day in the field of model training. Some of the challenges related to patient data usage in the model training that I talked about earlier can be alleviated with the help of federated learning, wherein the training task is divided into smaller computing units. Now, these units train a subset of the model locally using a patient data and then upload the training set to the controller, which will be integrated into the final model. Now, the patient data does not leave the computing units at any point during this training process. Now, combined with the explainable AI, this approach can substantially increase the number of participants as well who are willing to share their medical data. Now we are in an era wherein our handheld devices are becoming more powerful than our desktop devices. So this increase in computing capacity has opened up the paradigm of edge computing, wherein models can reside in devices and aid the healthcare workers in remote areas with limited network connectivity as well. Now, uh, with the with now we know that with the advent of practical quantum computing, researchers have also started to apply quantum algorithms to machine learning. Now this can as well vastly improve and expedite the whole model training processes, which had followed traditional process so far and as a result were slow. Now, all of these improvements will cater to a holistic patient experience platform, which will speed up the diagnosis, reduce hospital admissions, and greatly, improve the overall quality of life and care which is being provided. In order to bring these ideas to reality, my recommendation is to invest in AI/ML capabilities and foster interdisciplinary collaborations. Building an AI model or developing the application around it, and then finally getting all of the regulatory approvals require a lot of effort and is only feasible with a multidisciplinary team. Therefore, becoming before becoming a registered and certified doctor, all medical students are still required to take the Hippocratic oath, right, wherein they are expected to prioritize the well-being of the patient. So this is true even when building AIML applications for healthcare. Applications should put the needs and safety and security of the patient at the forefront, and models powering these applications should always be ready to learn and adapt. These would help to build immensely popular and successful applications and improve health for everyone. Now, in conclusion, I would like to reiterate that AIML is completely reshaping how we perceive healthcare. However, while AIML has the potential to be disruptive and transformative, we must follow a strategic and ethical implementation to be able to fully realize its potential. If there is just one takeaway, it should be that we require a collaborative and a human centric approach to design our models and applications surround them. So I would like to thank you for giving me this opportunity to share my experiences. And my email is listed below if there are any questions. Yeah, so have a great day and don't stop.